episode 281 of the 40 Plus Fitness Podcast, we meet Dr. Bruce Fife and discuss his book, Ketone Therapy. You can find the full show notes for this episode at 40plusfitnesspodcast.com/281. Have you decided you're ready to make a change? To reclaim your health and fitness? The 40 Plus Fitness Podcast is here for you. I'm your host, Alan Meisner. I'm an NSAM certified personal trainer with a specialization in corrective exercise and fitness nutrition. Let me be your coach as you find your way on your health and fitness journey. All right, let's go. Hello, and welcome to the 40 Plus Fitness Podcast. I am so glad you're here. Thank you for being a part of the podcast. Today, we have an interesting guest, Dr. Bruce Fife, and his book that we're going to cover is called Ketone Therapy. Dr. Fife is a certified nutritionist and a naturopathic doctor, and has written over 20 books, quite prolific in his writing. In fact, I want to have him back on in a couple weeks. We're going to talk about his book, Stevia Deception, but today we're going to talk about ketones and ketone therapy. Dr. Fife is a huge fan of the health benefits of coconut oil, and so much of his book is geared towards coconut oil, but he's got a lot in there about the health effects of being in ketosis and using ketosis. And, you know, it's not common to find doctors that are really interested in this topic and pushing this topic. And he, again, being more than just a doctor, being a certified nutritionist, has taken the time to look at this from both perspectives. So I really respect that from Dr. Fife, and I know you're going to enjoy this episode. Before we get into the interview, though, I did want to take just a moment to kind of give you an update. I had the surgery a couple months ago, been going through the therapy and whatnot, and so that's been both painful and interesting as I've watched my shoulder kind of mend and get stronger. Yesterday I did get the all clear from my doctor to go on and do my life and live my life. He was very clear that I probably wouldn't feel normal as far as the way I looked at normal before the injury for about a year. And he's right. There's still some popping and grinding and things that are going on in my shoulder that weren't happening before. That's normal, and that's going to slowly kind of blend in and go away. But just wanted to let you know that I had gotten the all clear and the farewell from my orthopedic surgeon. Got a little bit more therapy to go ahead and do just to make sure that I'm getting to a strength point where I'm not going to re-injure myself. But I'm pretty much done with that as well. So everything's gone as planned. That's not always the case when you go through a surgery like this, which is why I want to caution you that if you do injure yourself, go see a doctor, and then go see your physical therapist. Do those things because they're going to help you get on your feet the fastest. Don't just ignore it. Don't just say you're going to live with the pain. And don't just get into the pain medication as a way of coping with what's going on. Get to the root cause. Go ahead and get it fixed. It's not always surgery, so don't always think that that's the route that you have to take. But when it is, obviously I tore a muscle, so there really wasn't much I could do as far as hoping that muscle would reattach itself. I was going to be permanently unable to lift my arm over my head if I didn't take the time to do that work, to have the surgery, to go through the pain of it, and to work my way through the therapy. So I do strongly encourage you to follow the right path, follow your mind, and get healthy. Because we need to be moving, we need to be doing those things for our health and wellness. And, just sitting around, keeping your arm braced, trying to avoid the pain is not necessarily the answer. Sometimes you have to run to the pain a little bit just to get past it. So, again, things are going well there. And I do appreciate you sticking with me through this period of time. I hope you learned something from my pain and suffering. I tried to make this a little bit of a learning experience for someone that's dealing with rehab, and I know it's hard to be patient, it's hard to do the right things, but you just really need to if you want to remain healthy as we get older. So with that, I will go ahead and get you over to the interview. With no further ado, here is Dr. Fife. So Dr. Fife, welcome to 40 Plus Fitness.
Well, thank you for inviting me. One of the core concepts that I have in this podcast is that I like to bring people on with different perspectives. I actually do practice keto, so I don't. This is not a keto show per se, but it is something that I practice for myself and for various reasons, which I think we'll get into in this podcast. But I'm really excited to have you here because your book, which is Ketone Therapy. I'm sorry, is really good. I mean, I've read a lot of books on ketosis, as you might guess, since that's one of the things I do. But really, just kind of enjoyed the way you put this together. And obviously, you've written other books on ketosis and coconut and whatnot. So I do want to get into that, but I do appreciate the time and effort you put into not only just writing the book, but there's a lot of research behind it too.
Oh, definitely.
So I kind of thought about the timing of probably the publishing of this book, and so I have to ask this question, and I didn't put this out there in front of you, but the American Heart Association put out an article not too long ago about how coconut oil is going to kill us. You actually throughout the book are a huge fan of coconut and other books that you've put out before. So could you kind of talk a little bit about coconut oil, because I think it's something that's really it's kind of jarring when you have so many people saying it's a health food, and then so many people saying no, it's not. And so can you kind of talk about that a little bit?
Sure. Coconut oil is primarily a saturated fat. So the cholesterol theory of heart disease basically says, cut down on cholesterol and eating saturated fat because those raise your blood cholesterol levels and then promote heart disease. And that's the theory that has been the most popular for 50 years or so. But now we're learning that saturated fats aren't the villain. They aren't bad. They're actually good. In fact, if you look at traditional diets, coconut oil and animal fats were the predominant fats in people's diets. And this is back when people didn't have heart disease or Alzheimer's or Parkinson's or any of these chronic diseases that we have now. But it's more of a modern disease with our modern foods. And coconut oil is really spectacular. It has so many health benefits. In fact, when I was first trained in nutrition and naturopathic medicine, I learned that saturated fats were bad and they promote heart disease. And then I had a colleague tell me that coconut oil didn't promote heart disease, but it was very healthy. And that totally shocked me. It shocked me so much that I wanted to look into it more. And so I looked into the medical studies, the research that was done on coconut oil. And I started finding all these wonderful things about coconut oil, and it intrigued me so much. I looked up just about every medical study published about coconut oil. And in that research, I found wondrous benefits associated with coconut oil. In fact, I didn't find any harmful effects with natural, normal, unadulterated coconut oil. And I knew that people didn't know this, and so I felt a need to tell people about it, and that led me to write my first book on coconut oil. That was published back in 2000. It was called The Coconut Oil Miracle. And since that time, I've continued to learn more about the benefits of coconut oil and saturated fats in general and diet and health. And so I've written a number of books on these topics. And coconut oil, for example, has a lot of health benefits that are unique to coconut oil because the fats that make up coconut oil are actually different than the fats that make up other oils, even other saturated fats, and they're known as medium-chain triglycerides or medium-chain fatty acids. And these medium-chain triglycerides have particular health benefits you won't see in olive oil, you won't see in flaxseed oil or borage oil or krill oil or any of these other regarded oils. And for example, some of them would include, it has antimicrobial properties. So it's able to help protect us from infections from bacteria, viruses, and fungi. They also, they're not broad spectrum antibiotics because they don't kill all microorganisms, but they're selective. And so they're good for digestive function. So they'll kill the bad guys in our digestive tract, but they won't kill the good guys. And so coconut oil helps promote good digestive function. In fact, these medium chain triglycerides, besides being in coconut oil, another source of them is human breast milk. And one of the purposes that they're in the milk is to prepare the infant's digestive tract and to establish a healthy gut microbiome. Coconut oil is also very easy to digest, and so if you're eating a lot of fat, such as in a ketogenic diet, coconut oil is easier for a lot of people, particularly if they have things like gallbladder disease or if they have problems digesting fats. They can handle coconut oil even better. And one of the marvelous things about the medium chain triglycerides is that they are naturally ketogenic, unlike any other fat, meaning that when you consume coconut oil, they automatically are transformed into ketones. And so they make the ketogenic diet more effective. In fact, you can get a lot of the benefits of a ketogenic diet simply by eating coconut oil. So there's a brief summary of some of the benefits of coconut oil.
And the funny thing is, it's like, I think everybody wants a simple rule. If this, then that, so we can sit there and say saturated fat's bad. This is bad. That's good. This is, and unfortunately our body's a little bit more complex and so there's some saturated fats that are obviously going to be, not so healthful, and there'll be some that are actually quite good. And I think the next time my doctor tells me to cut back on saturated fat, I'm going to say, well, okay, I have this little bit of belly fat here I want to lose. What's that made out of? And if I free that up into my bloodstream because I'm burning it for energy, is that not just doing the same thing eating saturated fat would do?
I agree with you.
So maybe I don't want to lose weight. I don't want to lose that little pouch. I want to keep that there because it's trapped all these toxins and it's saturated fat. And so it's probably better for me to just keep it there, right, than to lose it. Although all the studies say it's probably better for me to get as lean as I can possibly get.
Well, it is, particularly when you talk about belly fat, because you do want to get rid of the belly fat because that's the visceral fat.
Yeah.
That's fat that has been associated with diabetes and other health problems. So if there's any fat you want to lose in the body, it's the belly fat.
Except it's saturated fat with all those toxins in it, so...
Well, the toxins is another issue, but it's both saturated fat and monounsaturated fat.
Yeah. So, when I got into your book and you said, the ketosis eating, and I don't like to call it a diet, only because I think people equate a diet with a temporary thing, and it can be a permanent thing. And we're going to talk about cycling later. But I just, a lot of people that are into this now that are talking about it, they're saying this is just a way of eating. And so I'll use that occasionally, and we might use the term diet and just realize that from my perspective, I kind of mean them both in the same way. But that the eating to keep yourself in ketosis is basically anti-aging. Could you take a little bit of time to talk about the anti-aging aspects of being in ketosis?
Sure. There's a lot of things that researchers have discovered that promote aging or promote premature aging. Some of that includes chronic inflammation, advanced glycation end products or AGEs, oxidative stress, elevated glucose and insulin levels, and obesity, in fact. all help promote aging. And so if you want to slow down the aging process or even reverse it, you need to reduce all of these things. And it's very interesting that the ketogenic diet addresses each one of these. For example, chronic inflammation. If you want to reduce systemic inflammation, best way to do that is with a ketogenic diet. It's interesting that when we eat foods, the carbohydrates in our diet are converted into glucose, and our cells burn glucose as fuel, just like a car burns gasoline. And just like in a car, when you burn gasoline, you've got an exhaust pipe, and you're producing a lot of smog. A lot of toxic fumes come out of that car as a result of burning gasoline. Well, basically the same type of thing happens when your cells burn glucose. When you burn glucose, you get smog, more or less, in the form of free radicals. And free radicals are highly reactive molecules that actually attack and damage our cells, and so they're generally not good things to have. You're not supposed to have a lot of them around, but every time you burn glucose, you're producing these. Well, one of the good things about ketones, or the ketogenic diet, is the ketones are an alternative source of fuel to glucose. The cells can use ketones in place of glucose, and when they use ketones, it's like putting a clean fuel into your car. The exhaust is much cleaner, so you don't have the free radical production that you normally would have, and so your body is much healthier simply because of that. And some of your listeners may not understand what exactly is a ketogenic diet, but basically it's a very low carb, high fat, moderate protein diet. So it's high fat and it's very low carb. And this is important because one of the major things that promote aging is excess blood sugar. So when you eat carbs, these carbs are going to be turned into glucose. They're going to raise your blood sugar levels. Well, as this blood sugar is in your body, it reacts with proteins particularly, but also fats in your body to produce what I mentioned earlier as AGEs, advanced glycation end products, which kind of gum up your body, and they too also produce free radicals. And the reason they're called AGEs is because that's what they do to the body. They age the body, and the higher your blood sugar levels are, the more AGEs are formed in your body, the more free radicals are formed in your body, and the quicker your body ages. But when you go on a low carb ketogenic diet, your blood sugar levels remain lower. So there are less opportunities for AGEs to develop. So you're slowing down that aging process.
Yeah, so I'm sorry, just to kind of recap a little bit of what you talked about is like when we talk about a ketogenic diet, what we're talking about is keeping your fats relatively high, relative to what we typically would eat, which is about 30-35%. We're talking more in terms of 60 to 75%, maybe even a little higher at times. You're looking at your body actually using body fat in many cases, and we'll talk about weight loss later, but your body's burning body fat, so that's some of the fuel source it's getting. So maybe even more calories or total burn coming from the fat. Generally a moderate protein, and then a very, very low carb. From the perspective of what a standard American diet would have you eating, and so it's a situation where your body actually turns into a fat burning machine, and you're providing it with just enough carbs, just enough glucose to manage the rest of what your needs are, to basically be healthy and do things, because you can't and you said this in the book, you can't 100% fuel your body on ketones.
That's correct. You do need some carbs. And so just as you mentioned, the ketogenic diet gives you just enough carbs that your body needs, but your body is using ketones and fatty acids as its primary source of fuel. And this has a lot of effects. As I mentioned, it reduces chronic inflammation, it reduces free radical production, it reduces age production, and as a result, a lot of parameters that measure health improve dramatically. And so it improves your blood glucose levels, improves your insulin levels. It improves even your hormones. Hormone levels. People nowadays often have unbalanced hormones. Well, the ketogenic diet can help balance your hormone levels. It even helps to stimulate the production of human growth hormone, which is known as the youth hormone. And athletes often use synthetic human growth hormones to improve their strength, to lose excess weight, and improve their athletic ability. And a ketogenic diet helps to naturally produce these growth hormones that help make us look and feel and be younger.
Yeah.
So basically, those are the main points of how the ketogenic diet can help slow down the aging process. And oftentimes, if you're suffering from premature aging, when you go on the ketogenic diet, a lot of the health problems that you're suffering through, some of these health problems that are often associated with age, are reversed. And so it actually reverses the aging process.
Yeah. I say that from a perspective, and I guess that's all that really matters in the end game is how you look and feel is really the end game. You're still on your aging path, but the unfortunate thing is with the diet we're probably eating today, if we're not really managing this well, is we are aging ourselves faster than we should.
Definitely, yeah. I mean, look at the heart disease rates, look at the Alzheimer's rates. And it's interesting that a lot of these diseases used to be considered old age diseases, but people are getting these diseases. They're getting heart disease, Alzheimer's, diabetes at younger and younger ages. It's not unusual now for people in their 20s or 30s to be diagnosed with type 2 diabetes, which used to be called adult onset, diabetes, because people only got it in their 60s and later, but now people are getting it at young ages.
Yeah. So one of the interesting things in the book, and I really wanted to pull this out, was you talked about how ketosis can actually protect and restore vision problems.
Yes, that is interesting, and I don't hear too many people talking about this, but there is research on this that, if you look at the major degenerative eye diseases, that would include cataracts, glaucoma, macular degeneration, retinopathy, particularly diabetic retinopathy. These are the major diseases that cause blindness. Every single one of these are associated with high blood sugar levels and insulin resistance. And so if you can control your blood sugar levels like the ketogenic diet does, and if you can control insulin resistance and even reverse it, which the ketogenic diet can do, then you will help prevent or reduce your risk of ever experiencing any of these diseases. And one of the things about these diseases is you can't tell if you're going to get glaucoma 5 years from now, or macular degeneration, or even cataracts. You don't know at this point. Those are things that just kind of happen. But you can prevent them with a ketogenic diet. And I'm a great example of this because about 18, 20 years ago, I was diagnosed with glaucoma. At the time, I noticed that my vision was a little bit off, and I needed to go to the doctor and get a new prescription for my glasses. Now, I've worn glasses all my life. And so I went to the doctor, and he went through the normal testing. He went through the glaucoma test that they always do, and he stopped And he kind of hummed a minute, and he said, "Let me try that again." And so he took me again, the second time, through the glaucoma test. And after the second time, he says, "I think you've got glaucoma." And so he recommended that I go to an ophthalmologist to confirm his diagnosis. And so I made an appointment with an ophthalmologist. He ran me through the tests, and it was confirmed. He told me I had the beginning stages of glaucoma. And with glaucoma, there's no cure, no medical cure for glaucoma. All you can do is manage it with medication to slow down the progression of the disease. Well, at this time in my life, I was making changes in my diet and my lifestyle. And I was changing the type of fats that I was eating. I was getting away from the polyunsaturated fats, the hydrogenated fats, and I was incorporating good fats, particularly coconut oil, in my diet. And I was eating more natural foods. And I thought, well, maybe my diet and lifestyle change will help stop the progression of my glaucoma. So I didn't use any medication, and I just went on my merry way. And after a couple of years, I started noticing that my vision was starting to change a little bit. And so I figured, it's time for me to go back to the optometrist, have him check my eyes, and check to see what was happening with my glaucoma. And this was 2 years, after the initial diagnosis. And so this time, I went back to a doctor. I went to another optometrist this time, and he went through the same testing, and he went through the glaucoma test, and he didn't say anything. So I said, "Doctor, how did my glaucoma tests come out?" And he says, "Oh, you've got healthy eyes, no sign of glaucoma. No sign of glaucoma." Now, this shocked me because I wasn't even hoping to have completely reversed the glaucoma. I was hoping that my diet and lifestyle would slow it down or stop it. He also said, interesting thing is your eyes have actually improved since you had your last prescription. And so not only did I reverse glaucoma, but I also improved in my vision. So I got a pair of glasses that were weaker for me than the ones I had gotten 2 years previously. Now I've been back to the optometrist several times through the past 18 years or so, and every time I passed the glaucoma test with flying colors. So, I attribute this to the change in diet, to getting rid of substances in my diet, particularly the vegetable oils that promote free radical generation and can damage the eyes, and replacing that with coconut oil, which can produce the ketones naturally, which can come in and help heal my vision.
Yeah, and I think the core of that is, you're basically keeping your total blood sugar low enough that it's not putting you into a place where you're going to get to a point where you're going to have retinopathy or macular degeneration or glaucoma or cataracts and all that, because in fact you're just not putting the fuel out there that's going to burn bad and cause those problems.
Right. I like to point out that the coconut oil produces the ketones, which are very therapeutic. But if you're going to be eating a lot of sweets and candy and desserts, you're defeating the purpose.
Yeah, absolutely. Now, a lot of people, they get into this health and fitness thing because obviously they recognize it's finally time. It's finally time to drop this extra weight that I put on in my teens and 20s and 30s and 40s, and so it's time for me to actually do something about this. And so we're looking for that secret pill, that thing we can do that's really, really easy. And I can tell you, ketosis is not easy, and you actually talk about that a little bit in the book. But ketosis is actually a very good way to approach weight loss. So could you get into that a little bit?
Yeah, in my opinion, I think the ketogenic diet, in terms of weight loss, is probably the most effective, most efficient method to achieve that goal. And there's reasons for that. I've been on diets in my life too, like many other people, to lose a few pounds. And the hardest thing that I experience when I go on a diet, and I know it's with probably everyone that goes on a diet, is the feelings of hunger that you have because you cut down on your calories so much that you're always hungry, you're always starving, and it makes the diet arduous. It makes it so difficult to live until finally you just say, I've had enough of this. I'm going to just go back to eating normal again. And so one of the great things about the ketogenic diet is that once your body has adapted to ketosis and starts producing the ketones, and this takes a few days to do this once you started a ketogenic diet, that your hunger is greatly reduced. You don't feel the hunger that you do on a normal diet. And so you can cut down on your calories and not feel starved all day long. You can eat a meal and feel satisfied. Feel satisfied not only because it tastes good, but you won't have the nagging hunger that follows you around on other weight loss diets.
Yeah.
Now, one of the big problems with low fat diets, the opposite of the ketogenic diet, is that when you take, fat is considered the primary cause of weight gain because fat contributes twice as many calories as, say, carbohydrate or protein. So logically they say, well, remove the fat and then it'll be easier to lose weight. However, fat satisfies hunger. It slows down the emptying of your stomach so you feel fuller longer, so you don't have a tendency to want to eat between meals. And when the next meal comes around, you're not so starved that you overeat at the other meal. So fat actually is one of the primary weight loss aids to help you lose weight. And people don't understand this, but they need to if they want to be successful in losing weight. And so on these low-fat diets, they remove the fat. This just makes them hungrier and makes the diet even harder to live. And when you remove the fat, you have to replace the fat with some bulk, something else. And so normally it's replaced with more carbohydrates, whether it's vegetables, bread, beans, rice, whatever. But it's replaced with more carbohydrates. Well, one of the problems with this is when you eat the carbs, they're going to be turned into glucose, which goes into the bloodstream and it raises your blood glucose levels. Now, your cells use glucose for energy, but they can't get access to it without the aid of the hormone insulin. Insulin essentially opens the door on the cell membrane to allow glucose in. So when blood glucose levels rise, your pancreas starts pumping out insulin to get the glucose into the cells. Well, which means every time you eat a lot of carbs, blood glucose levels rise and insulin levels rise. Now, the problem with this is that insulin triggers the conversion of glucose into fat, and not only does it take glucose and put it into your cells, it also takes fat and stuffs it into your fat cells. Insulin is a fat storage hormone. So every time you eat carbohydrates, you're elevating your blood insulin levels, which turns your body into or transforms your body into a metabolic state in which it wants to store fat. It wants to make fat and store it. So high carb diets actually promote weight gain. And there's been a lot of studies on this. There is some interesting early studies, even back in the 1950s, where researchers would put people on a 1,000 calorie diet, which is a low calorie diet. And they would, for example, in this one study, they had a group of overweight people, obese people. They put them on the 1,000 calorie diet, and they ran them through a set of 4 different diets. One was 90% carb, another one was 90% protein, another one was 90% fat, and then the fourth one was a mixed diet. Well, what they found was that the participants lost the most weight on the 90% fat diet because insulin levels maintained low. Fat doesn't cause insulin levels to rise. Now, those that ate the 90% carbohydrate diet had the least effect in weight loss because the carbs increased their insulin levels. And even though they were on a very restricted calorie diet, only 1,000 a day, it was hard for them to lose weight. In fact, the 90% carb diet was less effective than a mixed diet where they had fats and protein and carbs together. So it was the absolute worst diet that they could have used in order to lose weight. And there was another very interesting study done by other researchers in which they compared 2 groups of overweight people. And in one group, they again gave them 1,000 calories a day, 90% fat. That was one group. So it was a high-fat, low-calorie diet. The other group, they put on a total water fast, where they didn't eat anything. The only thing they consumed was water. Well, the diet went for a couple of weeks, and at the end, the group that was fasting, consumed only water, lost 7.5 pounds of body fat. However, the group that was consuming 1,000 calories, 90% of it fat, lost 14 pounds, and actually twice as much weight than those that were totally fasting. And so the high-fat diet was more effective than eating nothing at all. So the ketogenic diet is a high-fat diet that will help people lose weight without all of the struggling and pain. It may not be a walk in the park, but it's sure easier than the low-fat diets.
Well, I do wish the calorie in, calorie out guys would actually pay attention to that study because obviously, 1,000 is more than none, and so by math, you would say that the people who ate none should have lost more weight. But that is kind of one of the crazy things about it. Our body is not that simple, and trying to put a simple formula out there and say this is the way our body works just doesn't always work out.
Fat's been demonized for such a long time that people think of it as an evil villain. But our bodies actually need fat. We have to have fat. In fact, if you don't eat enough fat, your body will ramp up its production of fat. It will activate enzymes that turn whatever you do eat into fat. So if you eat a low-fat diet, your body will actually produce more fat than if you eat a high-fat diet, which seems, crazy, because people...
Well, no, it actually doesn't. And that's one of the things I want to get into with the keto cycling is basically this, is to say, okay, so let's think about our ancestors, and let's think about, okay, so we get into the spring and summer. And so now at this point, fruit and high starch vegetables they're abundant, and
right.
And we're eating the crap out of them because we've gone through a long cold winter. Be eating just basically fish and meat and some shrubs and whatnot. We could dig up maybe some tubulars here and there, but reality is we've pretty much been fasting and starving and eating generally ketogenic. So we're in a ketogenic state coming out of the spring, no doubt. And now all of a sudden we've got berries and fruit and melons and whatnot, depending on what geography we're in. So at this point, our body's job is to store enough energy to make it through the next winter.
Yep.
So it would make sense from a theoretical perspective that, yes, when you're eating a high-carb diet, your body's job is to store fat.
Yes, exactly.
So that's one of the things is I actually, because I don't have a therapeutic need at this point to be in ketosis all the time, I kind of do like to cycle in and out. Now, I don't do it concisely with the seasons, but I do kind of like to spend at least, some period of time outside of ketosis, and, good part of the year, most of the year, because I'm going back, I'm right now I'm working my way back into ketosis. Well, I am in ketosis, but because I get back in pretty quickly, but I'm, slowly kind of getting myself deeper and deeper into it as I go into the winter. But can you talk about keto cycling? Because I think a lot of people think this, is this way of eating, it's something you either do or you don't do. But I do think there's ways that you can kind of figure out the best mix for your own health.
Sure. Some people think of a keto diet as something that they need to be on for the rest of their life. And you can be on a ketogenic diet forever, but you don't need to. In fact, it's generally healthier if you do not do that. It's better to do keto cycling. And keto cycling is what, as you mentioned, our ancestors have done. When you're fasting, your body goes in naturally into ketosis. And so our ancestors didn't always have access to food every day. When they went hunting for deer and game, they weren't always successful, and so they went hungry that day, or maybe a couple of days, or they had only a limited amount to eat. So they naturally keto cycled and went through periods of fasting. This is just a natural thing that our bodies know how to do and that our ancestors have done for thousands of years. And I have found that keto cycling is more effective than being on a straight ketogenic diet. And the reason is that when you're in ketosis for an extended period of time, it seems like the body begins to adapt to this different metabolic state. And many of the health benefits associated with ketosis tend to decline a little bit over time. And if you can take a break from ketosis and then go back into it, then you get the full benefit again. And so I recommend that people and go into ketosis for a while and then come out for a while. And this not only is more effective way of doing ketosis, but it's a whole lot easier, and it makes ketosis or makes the ketogenic diet much easier to do, and people become more willing to do it. And I agree that ketosis is something you really should do for your entire life, but you got to do it in cycles. And the type of cycles really depends on you. Do you want to be in ketosis for example, you can be in ketosis for a month, and then you can be out of ketosis for a month. You can alternate it like that. Or you can be in it for a month and be out for 2 or 3 months. Or maybe you can be in it for 3 months and out for 4 months. I mean, it all depends on...
Or you like tailgating during football season, and you can't give away the beer, so you're going to drink beer during football season, and so that's your out,
Exactly. I mean, one of the things I find with ketosis, when people go into ketosis, that their birthday comes around, Christmas comes around, and they're so tempted, and so they're tempted and they do it. Well, when you do cycling, you can actually plan, okay, my birthday's in this month, Christmas is on this month, I will be out of ketosis during those months, so I won't feel guilty when I'm cheating, because it won't be cheating in that case, and it will be good for you.
Yeah.
And it will also keep you from feeling deprived. Oh, I can never eat another peach again. Oh, I can never eat another watermelon again. If you're on continual ketosis. But when you cycle, okay, right now I'm not eating melons right now, but next month I can eat it. I'm okay with that, and it makes it much easier.
Particularly when you're eating seasonal foods, and
Yes.
particularly down where I live in Louisiana and Florida, is hey, the spring and early summer is a great time for watermelon, and so we start, it's there. It's just you see the little trucks parked by the side of the road, and you're like, gee, I'd like to have a little bit of that, and there's no reason to deprive yourself. You just plan it out.
Yes.
Now, one of the things that's interesting, because I do pay a lot of attention to folks that are in ketosis, because I do use it, is that what happens is, and you mentioned it, a lot of them will hit this kind of homeostasis. Their body will kind of get accustomed to being in ketosis, so their overall weight loss stops. The anti-aging and the other things that they've noticed that have happened, they kind of level out. They kind of basically hit this balancing act that our body loves to do.
Mm-hmm.
And so a lot of them will kind of transition into fasting as another approach. So cycling is one good approach, but a lot of folks will then, and I do this as well. I do it just naturally, just kind of get into fasting, and particularly intermittent fasting. So could you talk a little bit about intermittent fasting as an approach to ketosis and keto therapy?
Yes, fasting is great too. In fact, just like our ancestors, they did fasting, so it's something that's natural. It's something very healthy. And when you're fasting, you actually go into a deeper state of ketosis. And traditionally, people think of fasting as, well, you're not going to eat anything other than water for 3 days, 7 days, 14 days, or however long. But then you've got intermittent fasting, which is actually much easier than prolonged fasting, but it has the same end result, the same benefits. So there's many different ways to do intermittent fasting. One is to eat one day and then fast the next, do it like that, or to fast 2 or 3 days out of a week, because that has been shown to be very beneficial. And some methods, it's probably the simplest or easiest way to do intermittent fasting is to do it every single day. In other words, what you fast for a certain number of hours every day, and then you eat for a restricted period of time. For example, you may limit your time to eating to 6 to 8 hours a day, and so the rest of the time, the 16 to 18 hours that you're fasting, you don't eat anything. Now, most of this time you're sleeping, so you don't notice anything, and so it makes it easy. And so, for example, you could have breakfast sometime after 9 o'clock, and then that means that when you have dinner, you would stop eating, say, around 5 o'clock, and then you would fast from 5 in the evening until 9 in the morning, depending on how long your fast is. That would be a 16-hour fast, or you can go on an 18-hour fast. And so you cut down your eating period for a couple of hours. And you can choose whichever hours. You could start your first meal at noon and maybe have your last meal around 7 or so. So you cater it to the way you like it. And fasting is great because it naturally cuts down on the total amount of calories you consume. It helps lower your blood sugar levels, so you're not producing these ages that age your body. You're eating less glucose, and so you're not producing the free radical exhaust that your cells produce when they burn glucose, and so it's an overall healthy state to be in. So when you're in ketosis, I like to do most of my fasting or even a little prolonged fasting where I go for a few days at a time when I'm in ketosis, because my hunger is already depressed, and so when I go into fasting, it's not that big of a deal.
Yeah.
Currently, right now, I basically do the intermittent fasting where I limit how much I eat to about an 8-hour period of the day, and then I totally do a total water fast one day a week.
Yeah, it's funny. I was in ketosis, and I bought this property, and I was out there working on the property. So I get up in the morning, and I don't eat breakfast, and I get out there, and I'd planned to come home around lunchtime, and I had some things I was going to cook, and so I was going to start eating probably about 2 o'clock. That's what I figured. So about noon, I go out and I get my truck, and I realize my truck is stuck. So I call the tow truck. The tow truck comes out, and he's trying to tow me out, and then his truck breaks. So he has to call someone to bring a part out and replace his truck. So I just basically go grab a fishing pole, and I go out, go fish in the pond, have a good time. Just I'm hanging out, and then I finally got home. It was around 6:30 in the evening, and at that point I realized, okay, I just basically didn't plan on doing a 24-hour fast, but at no point did I feel like I had the jitters or had to eat, or whereas if I'd been a sugar burner, there's absolutely no way. I'd have been like, okay, look, you got to drive me someplace and let me grab something to eat, because I can't sit here for 6 hours and not eat, because I'm going to have to be fueled. So that's one of the things I really do like about ketosis, is it kind of gives you that freedom to decide, because the hunger is just not as strong, and your body is learning how to use your own body fat for energy when it needs to. So it's kind of a win-win. It's not easy to get into, and there's some drawbacks to it, so you have to manage it and know what you're doing. And your book is a great resource for that. So I want to thank you, Dr. Fife, for being a part of 40 Plus Fitness. And if someone wanted to get in touch with you and learn about the multitude of books, because you've written quite a few, where would you like for me to send them?
Well, if they want to learn more about my books, about coconut oil, about ketosis, I would send them to the publishing website, which is PiccadillyBooks.com. And Piccadilly is spelled the English way with 2 C's. It's Piccadilly books, BOOKS.com.
Okay, and this is episode 281. So if you'll go to 40plusfitnesspodcast.com/281, I'll make sure to have that link there. So again, Dr. Fife, thank you so much for being a part of 40 Plus Fitness.
It's been my pleasure. Thank you.
Next time on the 40 Plus Fitness podcast, we meet Britt Brandon and discuss her book, Activated Charcoal for Health, 100 Amazing and Unexpected Uses for Activated Charcoal. Until then, have a happy and healthy week.